Hey everyone, welcome to HR Tech Talks. I'm so glad to have you here today. I'm Ben Eubanks. I'll be with you for the next half hour or so, interviewing our guests, sharing ideas, and learning alongside you. Actually, I was kidding a few minutes ago with our Amy, who's about to come on with me. I was telling her that tonight I have a chance to teach a analytics class for a friend, and she's going to talk to us about analytics, health intelligence, how we can use data around that to make better decisions. And as you're getting ready for that, and you're connecting in, let us know where you're connecting from. Where do you hail from? Where's home base for you? I'm down here in Huntsville, Alabama. We'll ask Amy in a minute where she is. And just one last note, this is the last week for HR Tech Awards. If you are submitting, get your entry in. And I'm so excited Amy's here this week. We didn't plan it this way, but Springbuk, the company she represents, is actually a winner last year for the exact thing we're going to talk about today. So it's a great way to maybe a meta conversation to have around that. So I'm so excited to have Amy here. Welcome. Good to have you.
Thank you. It's great to be here.
Absolutely. So before we dive into some of the stuff I was giving the audience a preview on, why don't you tell us tell us who you are and what you do.
Sure. I'm Amy Brown. I'm the VP of Product at Springbuk, and I'm actually based out of New York on Long Island here. And what we do at Springbuk is we create health intelligence for our customers that our customers are employers. And what we're really, and those that work on their behalf. So that could also be point solutions, brokers, and consultants as well. They use Springbuk, which is a cloud-based platform, to log in and instantly understand their biggest opportunities for cost savings and risk mitigation.
That is awesome. And that sounded so technical. So as we go through, we'll break that down and make it really practical and applicable, because that was one of the things that really surprised me when we had a chance to see what the team was up to last year. So let's start off with some of the top of mind things. So I'm a sucker for good research, and I know that recently a new report came out from the team there. So talk to us about some of the interesting trends and things that you saw in the last year. And again, it was a funny, strange year in a lot of ways, and health was center focus for a lot of people. And you have some really interesting and really probably unique data points there to share. So what was surprising for you?
Yeah, so we recently came out with our employer health trends report for 2020, and certainly COVID-19 was prominent. And I think this particular year also sort of really made clear the absolute importance of health analytics and health intelligence to really understand what's going on with your population. Because even if you thought you might have known what your group looked like before, the most important conditions and diseases and risk factors that your group might have, this year was a curveball for everyone. So it really showed how essential this type of information is to really understand what's going on. So when we analyzed our data, we have substantial data set of, more than 4,000 employers were part of this particular study. What we actually found was a 12-fold increase in telemedicine visits this past year. So we certainly saw with the major shift that had to happen with the shutdowns with COVID, that telemedicine, which was something that many were advocating for previously as an alternative solution to always having to go physically to an office, now it's becoming just sort of a normal way to do things. Mental health immediately was like the first thing that shifted in that vein because it was so easily transferable over. But all types of services across all age groups actually shifted in large quantities over to telemedicine, which has really helped us to see that telemedicine is a really valuable and important way that members can actually get care. And there's so much more that we can do remotely than we might have thought. Even things like physical therapy and other types of services, they found a way. When we have to pivot in those moments of pressure, it's amazing what can actually come to fruition.
Yeah, so when you're forced into that. Sorry, go ahead.
Sorry.
You're fine. I was saying when we're forced into that, we suddenly that thing that we can never do that becomes we did that. And so that was really intriguing to see. Go ahead and share some of the other stuff.
Yeah, and I think one thing that will be very interesting to see is, this omni-channel way of approaching care, remotely and in person. There's a lot of speculation that will continue in the long run. It really will benefit people that, it may not always be easy to find transportation, other things. Now we're really thinking creatively about how to solve for that for those that need it. Another thing that we found was that ER visits, particularly during the lockdown period in April, they decreased almost 45%. And that's a really interesting statistic. When we looked at the details there, we kind of sliced it out from different angles. And certain of those visits might have been ones that maybe were avoidable or could have occurred at a lower cost setting, what we call sort of avoidable ER visits. But there was actually an alarming number of drops in terms of things that we would always expect people to go to the ER for, things like heart attacks, those emergent events that we expect people to go to the ER for. They actually weren't during the peak of COVID. And that was a big concern, because we knew those things were just statistically still going to be happening, yet no one was actually going to the ER for those things. So a lot of local health systems in the area actually were encouraging people and putting out broadcasts on television, encouraging people, if you do have an emergency, we're still safe, please come. And our data actually supported the hypothesis that that was actually happening. And then another big area that we looked at, which was very, very, sort of prominent in the news as well, is elective procedures. So elective procedures are not necessarily things that we're opting into, but things that we plan for in advance. So things like hip surgeries, knee surgeries, even things like colonoscopies, where you plan for that in advance as a screening for cancer. So those obviously dropped off significantly during the peak of COVID, and there was a lot of speculation that there would be a surge once things got back to whatever our new version of normal would be. But there hasn't really been a surge yet, and part of that is, we think, because we haven't totally and completely fully recovered from this, COVID situation. Also, a lot of members are likely still hesitant to get those opt-in procedures. And so there hasn't really necessarily been this huge surge. There's also speculation about capacity issues related to whether hospitals are ready to, take in the volume that they once could because of all the additional protocols and safety measures that are required in the period of COVID.
Goodness. I just had an interview recently with the chief nursing officer at a healthcare system in the kind of Midwest. And one of the things that she talked about was that shift in their workforce, like internally, and for our purposes, right? It's about how do we handle the capacity, the different types of patients coming in, because she said it went from elective to, there's a tiny, only if it's like an emergency, critically elective. Everything else goes over here into COVID care in some form or fashion. And then she talked about how they have started shrinking that down as that other stuff starts coming back, as the COVID cases kind of get more handled. And so that was really intriguing, because I never stopped to think about it from that perspective. And again, you're seeing the other side of this in the data from the patient side, what they're doing,
Sure.
how they're trying to adapt to that. And that was interesting for me. You mentioned the ER thing. We had an unplanned and no way to prepare for ER visit for one of our kids, some, freak accident in the backyard that, and it was like going into a ghost town. And I've never been, in a hospital and had that kind of setting around. So it was really eerie kind of feeling and very different. But we were one of those that still had to go in that percentage, but it was definitely a different kind of experience. So neat.
Yeah, healthcare is changing in huge ways right now. And we hope that the good parts of that will stick, at least in terms of, forward thinking and pivoting in ways that maybe we, wouldn't have thought we could do before. One other thing actually in that vein that is worth mentioning with the elective procedures is that we've actually seen a big pattern shifting from inpatient procedures to outpatient procedures for things like hip surgeries and knee surgeries. So as a result of COVID and sort of avoiding that inpatient setting wherever possible, more of those types of procedures are now happening on an outpatient basis. Those did happen before, but not in the large quantity that we're now seeing as an alternative in 2020. So that's actually a more cost-effective way, and oftentimes a more optimal way to handle those types of procedures, and then the member can actually recover at home. So that seems to be a positive output of what's played out so far.
I was going to ask you, because you mentioned about 60 seconds ago, you said the good parts are going to stick, hopefully. And I was going to ask you to clarify, what are those good parts? And that sounds like part of it, like the less expensive, less resource intensive, less burdensome for the patient and for the healthcare provider. Is that what you mean there?
Yeah, exactly. So I think there are some things that were just kind of always that way. And in this moment, a lot of those providers in the system are now taking fresh eyes at the situation when they had to pivot and really thinking strategically about what is the best way to do this. So when we're doing virtual visits, which are far more common now, we're seeing that they're working really well in a lot of cases. There still are obviously some instances where someone needs to actually physically go to a doctor's office, but there's all kinds of great information out there. I saw at a conference, Hospital for Special Surgery is now doing PT remotely for those post-surgery, and they're finding better outcomes because they have physical therapists that are really well aligned with the types of surgeries that they perform there. The physical therapists that know that specialty really well are the ones doing the remote physical therapy care. Prior, those members would often just go to the local office in their town, and those physical therapists, it was hit or miss whether they had the background for that type of recovery. So there's a lot of great things that are coming out of this time, and I think the more those types of things hopefully can stick and allow for better patient outcomes.
Well, I think that's a good segue to the next piece I want to ask you about, because you're talking about the PT example. It's very tailored and individualized. It's personalized. You know enough data about that person, like what kind of surgery they had, who did the surgery, where they went, so what that process is going to look like. So what hopefully that recovery path will look like on the back end, because you've done that over and over again. It's really specialized. So let's skip over to the analytics piece of what you and the Springbuk team does. I'm curious about that. I'd love for you to talk more about it. You gave us kind of a high level of that overview earlier. Talk about how all this data you've mentioned in the last few minutes, all the insights we have around volume, everything else. Talk about how that kind of thing translates into data analytics employers can use to make better decisions.
Absolutely. I mean, I think we're living in this world of big data. I mean, I was looking earlier today, people are generating 2.5 quintillion bytes of data each day. And so there's no lack of data. I think we're very clear on that. The challenge we have is really taking that data and making it understandable, usable, digestible, and something that we can actually do to solve a problem. And so in health analytics, the problem we're trying to solve is to avoid future risk and costs that go along with that. And so with health analytics, historically, there's really been an emphasis on reports, sending reports, dashboards, and those can be useful if you have the right people reading them that have the right context, and that the analytics are being done the right way. But oftentimes that really falls short, and it's really hard to make sense of that information to really understand what's driving your costs. Who's going to have that disease in 5 years? Who's going to be diagnosed with diabetes in the future? Who has a disease and maybe they don't even realize it today? So that's what insights is all about, and that's what health intelligence is all about. We're using modern technology that we've grown accustomed to in other areas of our lives, like you shop on Amazon. Amazon curates that information. They know who you are. They know what you're interested in. They curate that so they can help you save time and effort. Same thing with Spotify, your curated music. With health intelligence, we're curating your health analytics information, and we're serving up the actionable opportunities within your data. So for things like potential cost savings for drug spend, looking at members that are at risk for future surgeries that might not be necessary, looking at members that are going to the ER when it's actually not the best option for them, and it's probably not a great experience for them, and it's also a really expensive experience. So really identifying those biggest opportunities for each employer, customized to their data, served up, so they can really understand the story driving their data and get direction. So we talk about how it's not just data, it's direction. So when you do a Google search or anything else in your life and you want to find the right information, when you search, coffee house near me, you want to see which coffee houses are near you, what are they rated, what kinds of drinks do they have. When you're looking at health analytics, you want to sort of in a similar vein, you want to see what's driving my costs and what can I do about it. So we provide curated information with each card. Each card is an opportunity. So avoidable ER, avoidable admissions, rising risk members for surgery, and we'll identify right there, this is the biggest, these are the biggest opportunities for your group. And here are some things you might want to do about it. You might want to work with a point solution vendor, that deals with ortho if musculoskeletal is a big issue for you. If avoidable ER is a big concern, maybe you want to consider an on-site clinic. If cancer screenings rates are really low and that, breast cancer, colon cancer, maybe you want to have a bus pull up to help do some screenings when people are back in the office again. Or remotely create some incentives for people to get those cancer screenings. So what we really do is we identify ways that you can find those opportunities in less than 5 minutes, create cohorts within Springbuk to track that group over time, And then you can use a product in a product called Timeline to actually chronicle that journey and measure the impact of the program you're implementing to help your population.
Goodness gracious. My mind's kind of swirling with just imagining all the different questions you could ask, all the different ways you could approach this. I want to ask you something. It's kind of a high level question. If someone is listening and they're thinking, okay, this sounds incredible, but maybe over my head, what piece of advice would you give someone to get started with this? Because you've said like just reporting on it isn't enough. Just sending out more data. Here, we've got a dashboard. Everybody's got a dashboard. All right, we need to make it. The keyword you used there was actionable. Right, we got to be able to just do something out of this. So, what advice would you give someone that's thinking, okay, I want to get my team on board. I want to get my company on board. How do I get started or sell this idea of analytics as a way of life for us as a team?
Well, I mean, come talk to us. Springbuk. The nice thing about Springbuk is we have a really intuitive user interface, and so what we hear from those that we speak with in the space is that it is so easy to use and so intuitive. So not only do we have all this great information, it is presented in an incredibly user-friendly way. So if you feel like you're a and okay, it snagged a second. Yeah,
Yep,
it's a partnership
okay,
for
you're back.
We're here to usher you in and help you to see how you don't need to be intimidated by your data. We have a team of experts. We have clinicians. We have data science. We're building models for you to help identify populations that might need help, and we're doing all the hard. We have the built-in expertise to help you and partner you to meet you where you're at, to get the information you need to help your employees live their healthiest lives. Because that's really what this is all about. We want to help people live their healthiest lives and have the best possible outcomes for them and their families.
I'm just thinking so many companies report on maybe overall, here's what it costs us to run our healthcare plan, or things like that. They report on some big picture things, but they're not specific or granular enough for them to say, okay, look, let's take this use case. You mentioned avoidable ER, or rising risk for surgery, or these people likely have cancer based on some kind of indicators we have, right? Those kinds of use cases can help them to take action, can help them to say, okay, we're not going to try to boil the ocean. Let's take one of these and tackle that. Let's try to solve for that population, that cohort, and hopefully make an impact there before we move on to everything else. It makes it more digestible, I guess it sounds like to me.
Right, and a lot of times employers are making blind choices about what programs to implement. They'll just pick the most timely topic, whether it's mental health or diabetes. A lot of times they're just throwing darts because they don't have good information to act upon to make data-driven decisions. So the whole idea with health intelligence is we're going to arm you with the information you need to make smarter decisions, and then it's ultimately up to them to make the best choice for their group. But at least they now have data points to better understand what's driving your costs and what you can do about it. And we build models that are also really innovative to try and think differently about these problems. So we have what we call an event predictions model, where we're identifying members that are likely to have a disease before they're actually diagnosed. So that way we can get ahead of that for conditions like diabetes, which is severely underdiagnosed. So people are pre-diabetic and don't realize it. People are diabetic and don't realize it. And so our model helps to pick those people out, because there's a 7 to 10 year period where the body is actually being damaged from those high blood glucose levels. And the member won't even know about it until it's too late, and then they've already damaged their organ system. So if we can get ahead of that, we can really change the trajectory of people's lives.
So you've mentioned things like claims data, things like that. Talk about a couple of the different, you don't have to go like in the secret sauce, but talk about some of the data sources that you can tap into to help understand this, because that sounds almost like mad science, be able to predict those things that someone doesn't even know they have yet. So talk about some of those ways that you're able to do that using that massive amount of data you can tap into.
Sure, yeah. So we have over 2 million lives in our database today. And so we can use probabilistic models to actually look at those that have been diagnosed with a condition, and then find those members that follow a similar pattern, that are likely to continue in that same trajectory based on what we're seeing thus far. So the main driver of that is going to just be claims data, believe it or not. Claims data is a huge driver I mean, it's a great longitudinal sort of data set that helps us to really see the patterns in utilization over time. We also at Springbuk have the ability to bring in other data sources as well that we find really valuable. So when our customers work with point solution vendors, for example, we're, like diabetes management or mental health or other things, we want to bring that data in and look at engagement. So we look at engagement in different types of programs and how that might impact populations. So we're also, interested in looking at, on-site clinic data. And so we can pull that in to see if an employer is working with an on-site clinic chain, we can actually see that data as well to better understand the impacts of those types of programs and also the cost savings that an employer might realize from that type of intervention program.
Wow, that's incredible. So I was just looking at the comments. Heather actually chimed in a minute ago and said they use Springbuk, and she said she loves the COVID-19 report. She said it's easy to use. So good to hear from someone who's actually a user out there too, chiming in, giving you a thumbs up on some of those things you're talking about.
Awesome.
We talked about kind of cost savings earlier with the outpatient versus inpatient or emergency, those kinds of things. What about risk mitigation? You're talking about this a little bit, but what is the long-term cost to an employer if they have someone who has diabetes? Because it may be like, that's the person's thing, or that's their privacy. We don't get in their space, but there's an actual cost to the employer over time if that person gets sick and is unable to work, right? Do you have any clue what that cost is for a person or at an aggregate level? I'm kind of curious.
Yeah, it's a great question. I mean, it can vary widely with diabetes based on the severity of the condition and the number of complications that member has. And that's actually, why we've focused on diabetes. It's, unfortunately, it's incredibly prevalent in this country, and it can vary quite a bit because when you move into the areas of having those higher level complications from organ systems, that's when things tend to get quite expensive, and we end up having those flare-up events, the hospital admissions, which can cost in upwards of hundreds of thousands of dollars potentially. So it can vary quite a bit, but a lot of times with diabetes, if you manage it well, it can stay low cost with medication management, relatively, in a stable fashion. So that the variation with diabetes is significant. And that's why we really want to help our customers to better understand, we focus a lot on gaps in care for diabetes as well. So looking at those members that are getting their HbA1c tested on a regular basis and eye exams and other sort of maintenance care for diabetes that will help a member to identify issues before they become severe and become expensive down the road. So that's a huge area of interest for our customers as well. We look at a wide array of gaps in care for chronic conditions as well as cancer screenings. And then you can easily create cohorts of those individuals within our product and then track that group over time as you implement interventions and programs to try and incentivize them to actually close that gap.
You've been in and around this health analytics, health data kind of space for a while now, and I'm kind of curious if there's anything, like, what's the biggest thing that you've seen change since you started looking at and paying attention to that space all the time ago? Is there one thing, or is it kind of a gradual evolution over time? I'm always intrigued by people who have that deep knowledge in a certain area to ask what might have changed over the period you've been watching this. Because I can tell you're passionate. I can tell you're excited about it. You're a numbers nerd. I mean, in the nicest way. But what has changed over time?
Many things have changed. I think one thing that comes to mind just on a foundational level is the technology. So I worked at a health analytics leader for many years, and it was what I would describe now as old school technology. So, old school servers, I would have to launch a report, and it would take 5 days for that to run for a large group that I was working with. I was working directly with enterprise employers often, and that was just normal. And one of the things that I was really excited about switching over to Springbuk is because Springbuk is a newer company, 2015. So we've been in the market long enough that we know we're very seasoned at this point, but we are new enough that we have incredibly modern technology that drives our reporting at a most foundational level. So within Springbuk, you can get answers instantly. There's no 5 days for running a report. It's instant answers. You can, as soon as you log in, you can filter your any dashboard within our product. So when you look at a health intelligence page and you're looking at your opportunities, you can filter by only employees. You can look at certain age groups. You can look at certain people that are only on certain plans, like the high deductible plan versus PPO, and it automatically updates instantly. So that was one of the things I was just blown away with, how, because we have a modern tech stack that we build everything upon, the amazing capabilities that now exist that, you know, before it just, you could never get to those answers. It would take you 6 months to get the reports to run. With Springbuk, you can see your group level and then drill down into those details to understand the story driving your data in less than 5 minutes. And the foundation for all of that is our tech stack.
One of the things you said, quick answers, a second ago, that reminded me, one of the things we had talked about before we started recording, and I meant to bring it back up because I think it's really powerful. I'd asked you at one point, like, how does someone get started with this stuff? And you had told me earlier that you can actually ask questions, not just doing database queries, but you can say, hey, how many ER visits do we have last year? Or you can ask something that's a question that your leader might ask you. You can ask that same question verbatim to the system, and it's smart enough to know the kind of things you're asking. Will you talk about that for a second? Because I think that lowers the hurdle for someone who's not sure how to start to get into this. If they know it's easy to do that. It's not I've got to know my 7 variables and I've got to be able to do a regression analysis and it sounds like it's much easier than that. And I'd like you to talk to that for just one second, if you don't mind.
Yeah, absolutely. I'm glad you brought that up. So another health intelligence product we have aside from Insights is something called Answers. So the idea is an HR leader or anybody else who's in the Springbuk platform might need a quick answer to a question. What's my rate of ER visits? You know, what's the average cost for a colonoscopy procedure if we're seeing a lot of people that may be due for that? With Answers, you literally type a question, and through our NLP powered search, you actually find the curated business questions that match for your search instantly. And so you can easily, you know, get that information about what your ER visit rate is. You can compare it to a national norm. So we have benchmarks built in right there on the page, and we'll also provide curated related questions that you can see, like, you know, if you found your ER visits, you might want to see what the drivers of those ER visits are, which conditions are the most common reasons for those ER visits. We have that all curated and presented to you. So you don't have to be the expert, and you also can get answers at your fingertips that someone might ask you on the spot that you weren't expecting. Answers empowers you to just get that information instantly.
Excellent. Awesome. And we're coming up close actually to our time. So I want to give you one last question in a second. For everybody who's watching, if you're listening to this or watching this on LinkedIn, you can click on Amy's name, or you can click on Springbuk in the show description and get right over there. You can follow them, you can connect with them, you can learn more that way. But if someone wants to connect, or they're watching this after the fact, Amy, what's the best way to learn more about Springbuk?
Please come to our website. We have a lot of great materials on our website at Springbuk, and we have a lot of case studies. We have all kinds of collateral that can help you to better understand how we can maybe help your population live a healthier life. Excellent. And that's Springbuk. Everybody. Yes. When you're typing that in, that's what you're looking for. Okay, wonderful. Well, thank you, Amy, for joining me. This has been fun. I have enjoyed this thoroughly. I've got some great insights to share with the class on analytics I'm teaching tonight. I'll give you all the kudos and all the credit. Don't you worry. So I really appreciate you hanging out with me today. My pleasure. Thank you. Absolutely. To everybody else, thank you for joining us. I hope you enjoy the conversation. I hope you learn some things. Again, Danielle, Karima, Heather, thank you for chiming in during the episode today. And everybody else that's watching this after the fact, go out there, get some better insight, better intelligence around your healthcare of your workforce. You can make better decisions on their behalf and to drive the business. I'm excited about all the good things they're doing at Springbuk. And again, hat tip to them for being an award winner for 2020, the HR Tech Awards. And I will catch the rest of you guys next week on the show. Looking forward to it. Every Monday, 11 Central. We're here. We're live talking to innovators in the HR tech space. Thank you so much. Have a great rest of your day.